Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Nerve fibers, we are looking at its types as well as the sensory neuropathies. So first is depending on the nerve fibers involved. So nerve fibers, it can be involved, so it can be large as well as small. And the sensory neuropathies are classified as follows, that is the small fiber, large fiber and the mixed fibers. So first let's move on to the small fibers. So this is nothing but the small fiber. So small fiber is a painful neuropathies. So small fiber, it includes a painful. So there is painful neuropathies. So in small there is a painful neuropathies. It is a dissociated sensory loss. So this presence of the dissociated. So dissociated sensory loss is present. So what are the small fibers? What is involved? So small fibers involvement, it includes a lepromatous leprosy. So there is a lepromatous. So this presence of the lepromatous leprosy. Then comes the amyloidosis. Amyloidosis. So there is lepromatous leprosy, there is amyloidosis, there is diabetic small fiber neuropathy. So there is diabetic small fiber neuropathy. So there is lepromatous leprosy, amyloidosis, diabetic small fiber neuropathy. And then there is also the HIV. There is also the HIV and the antiretroviral therapy neuropathy. Next is, so we saw the small, then we have the large fiber. So what is present in the large fiber? So in terms of the large fiber, there is it is nothing but the ataxic neuropathies. It is nothing but the ataxic neuropathies. So ataxic neuropathies, it includes the presence of the Sjogren syndrome. So there is presence of the Sjogren syndrome. So there is Sjogren syndrome, there is also the vitamin B12 neuropathy. So the Sjogren syndrome, vitamin B12 neuropathy. Then there is also the pyrimidine toxicity, pyridoxine toxicity. So there's pyridoxine toxicity as well as cisplatin. Pyridoxine toxicity as well as cisplatin neuropathy. Now this was about the small and then the large, that's Sjogren syndrome, vitamin B12 neuropathy, pyrimidine toxicity as well as cisplatin neuropathy. Next we look at the mixed. So here in terms of mixed, what is present? Mixed, it contains the small and the large fibers. So there is a global sensory loss. So it contains a diabetic sensory neuropathy. So there is a diabetic sensory neuropathy. So there is diabetic sensory neuropathy. There is also the hereditary sensory neuropathies. So hereditary sensory neuropathies. Then is the carcinomatous sensory neuropathy. There is presence of carcinomatous sensory neuropathy. To learn and grow daily like this, please do subscribe.